been to quite a few discussions about health reform, and they've always been quite siloed. So people are talking about fee-for-service or private versus public funding or imaging, all in silos, and not really thinking of the whole. You are not about producing fodder for the health system. But actually, when you think of the health reform agenda, that's exactly what it's about. It's about a new workforce, a new vision for health.
How we equip the health workforce for the future to be flexible and capable in its adaptation to changing circumstances. If there's a cure or prevention for dementia, how's that going to change the system? Immensely would be the answer. And these are things that we can't predict, but we can anticipate.
The reforms we've made so far, which really have been about devolution, about appointing boards that really have changed the way the health workforce works at the local level.
The projections are that in the next couple of decades, 1 in 4 people will be working in health. $110 billion will be the health budget, and I think that is about 6 or 7 times the whole budget of the whole state of New South Wales.
The very specialist roles of people, whether they're doctors or nurses or allied health professionals, will have to be much broader. They'll have to be much more of generalist persuasion. They'll need skills in management. They'll need skills in budget management.
The 2 key elements in the reform agenda that relate to us are the focus on primary care and the management of chronic disease, because we just haven't got it right, and preventive care, which we really focus very little on.
What is the most significant workforce challenge in Australia? Whoa, there you go. Enabling the health workforce to adopt different service delivery models.
One of the biggest challenges for us is actually getting graduates that can write in a way that is consumable to the business environment. The capacity to convey clear messages succinctly, to rationally produce an argument about options and then reach an informed conclusion based on evidence from an array of perspectives is actually a real challenge.
At the same time as the technical skills that our students need are increasing, not unreasonably, the community is expecting that also we should train people in some of these other skills that you're talking about. And I simply could not agree more.
Why is it that the universities still train nurses and midwives, medical students and allied health professions separately, apart, different language, different curriculum, different ways of doing things? We've been doing clinical placements in the same way, in the same manner for 1 trillion years. We put them out there, we give them a time, and then we take them back in and somebody ticks them off and marks them. What did they learn? Are they competent? Do we know? We don't measure. We don't understand even the system we have of how we do that. And we don't cost it.
More than 70% of people agree that we need to be working together across the disciplines and across the sectors. We need to find a way to do that. It's all very well to agree, but the barriers are enormous, and they're tiny little things like timetabling, but we've got to overcome them and do that together. If we are signed up to this vision, we need to be working together to achieve it.